Hi, Kristen Boland here, editor of Imaging Technology News, and I'm here with Christian Renaudin, the CEO of the MarkeTech Group, and we are talking about some of the top trends Christian is seeing at the RSNA 2009 annual conference. Well, Christian, some things that we're seeing at RSNA this year include, well, one of the big things is interventional solutions. What have you seen in that area?
Well, I think there's two areas. One is the C-arm technology, and the other one is the cath lab technology. In the C-arm, I've seen more improvements in the area of real-time reconstruction of a 3D image to guide the surgical act. So you could overlay that 3D acquired X-ray image and visually guide the surgeon's or interventionalist procedure. In the area of cath lab, we see also reconstruction almost real time because there's a lot more projections to acquire by the rotation of the gantry. They can do 360 as well as the other angle. And once the 3D dataset is acquired, you can actually manipulate the gantry to the desired angle from the dataset, and then continue your fluoro imaging to do whatever procedure you need to do, stenting or balloon angioplasty. So that is an interesting development that we haven't seen in recent years.
We're also seeing a lot of new technology for breast imaging. What have you noticed?
So this year is strong focus, I believe, in breast imaging, whether it's MRI or SPECT or PET imaging or tomosynthesis. So there's a theme, a general theme of focusing in breast imaging only. I think it's a growth application in every possible modalities, probably more likely in MRI. But the technology was already ready. It's just the vendors are focusing specifically on this application and dedicated systems. In breast imaging, we don't see new technologies per se. I mean, every single modality is technology ready for breast imaging. I think the vendors are just focusing finally on this application. So we see more and more dedicated system, whether it is for PET or SPECT or MRI, obviously we knew that, but also X-ray and some other modalities. So more focus in every booth, every area about breast imaging. So I think next year will be a very high growth market for breast imaging.
Okay. And Christian, as expected, we're seeing a lot of technology for lowering CT dose. And how does that tie in with the introduction of new MRI systems?
Yes, I mean, obviously, CT dose was a European concern until recent years, and since the New England Journal publications, I think there's been 2 publications in the last 24 months. The focus has been on dose radiation reduction, which is good news for the patients. The way vendors achieve that is by improving their reconstruction algorithm. I don't think there's any magic hardware technology. So there's a better utilization of the signal that is acquired. As far as MRI, MRI could benefit more from that dose debate. But I think CT is making a significant improvement, so I don't think there'll be a shift from CT to MR. Both modalities bring different perspective clinically, so I don't think there's a necessary duality there.
One more thing our readers want to know is how to find the technology that's really of interest to them, but that is not so readily apparent. How do they find that?
Obviously, my company, we are a consulting firm helping the vendors, so we're very sensitive to that. I do believe that the messaging, the vendor booth are not as effective as they should be to communicate the message, to communicate what's new in their offering. So the advice for the radiologist or the imaging director is to look for the hidden new application or new technology that is not necessarily advertised on the booth. So you need to go in the booth, ask a very specific question, and then you'll discover some very interesting applications like I did. But on the first glance, you will see this overall messaging that is not necessarily what you're looking for. So you do your homework.
Thank you so much, Christian, for giving us those important insights and meeting with us here at RSNA 2009.